was last weekend.
Last Saturday, right?
Yeah.
Ready? Okay, I'd like to call the December Human Services Committee meeting to order. First thing on the agenda is the approval of the minutes. Do I have a motion to approve the minutes from November 13th?
I'll move.
Mr. Pavlock?
Second.
Ms. Gustafson? All in favor?
Aye.
Aye. Privilege of the floor is next. Is there anyone here to speak to the privilege of the floor? Anyone here to speak to the privilege of the floor? Seeing none, we will go to our first proposed resolution, which is to confirm reappointment to the Chautauqua County Board of Health.
Good evening. Lacey Wilson, Public Health Director. Really, I'm here on behalf of the county executive who actually makes these appointments, but it is to our Board of Health, so I'm here on his behalf tonight. This reappointment is for Matthew Hanley, who has served on our board previously, and we very much so appreciate his willingness to continue. It's a
Matt's-
6-year appointment.
Matt's at TCC. He does a great job.
Yes, and has some great experience even prior to TCC and some local municipal government.
And being on the Board of Health myself, he's very, very good
Yes,
part of the board. So.
very much so.
You want good people on the board, because you just never know what is gonna face us next.
Yes,
So-
you know what, and there's a good thing going on the Board of Health too, because we're basically a complete board for the first time in a while, so that's been a wonderful thing. There's some good things happening.
Okay. Anybody, any other questions, comments? All in favor?
Aye.
Aye. Thank you. Proposed resolution number 2 is to reauthorize municipal early intervention and preschool contracts.
So really, this is a resolution, it's just a continuation of a resolution with some updates. There really isn't anything changing programmatically. These are state mandated programs, but we were made aware that it's become basically a regular practice of the county to update resolutions that are older than 10 years. So this resolution, when it was really first established, was established with kind of an indefinite timeline saying as long as these services were mandated by the state that this resolution would be in play. But just by way of doing some, cleaning up, and, kind of housekeeping sort of things, we were asked to just take a look at it. And when we did, there were some specific partners named in the original resolution that, we just don't work with any longer, SUNY, Fredonia, and different things like that. So we just updated the resolution to be more reflective of the contracts today.
Okay. Any questions? Concerns, comments? All in favor?
Aye.
Resolution number 3, authorize lease agreement with City of Jamestown for office space for Chautauqua County Health Department.
I'll stay here, and we're going to have Jessica join us as well.
Good evening, folks. Jessica Worsley, Chautauqua County Director of Environmental Health. So this is a resolution for us to expand into the Jamestown area a little bit. We have new staff coming on who have already been included in the 2025 budget. They're coming on to work with the lead rental registry program that's mandated through the state, and we need more space for them. The city of Jamestown had space, and they are going to be a strong partner in this effort to take a look at rental properties and look for lead hazards within the 14701 zip code. So they had space, we needed it, and the space will be, the rent will be paid for with the money provided by New York State for that lead rental registry program. The acceptance of that grant money went through resolution in June of this year.
And this is a 4-year term?
Yeah, so the current commitment that we have for that lead rental registry money from New York State is into 2029. So that's why the agreement, the resolution is set up for that same sort of timeframe.
You say Jamestown will be working as a partner with us. Will they be providing personnel or
So,
support of any type?
I mean, so Jamestown is certainly working on its own, like landlord agreements and rental property agreements and regulations. And so we've already been working with Jamestown as they're developing those and as we have this program going into play so that we can develop those programs together. So we talk to the Jamestown Code folks quite often and planning folks quite often to make sure that our programs are lining up. So if there are areas where we can overlap and they can help us and we can help them, that we're, nurturing those relationships now.
That's good.
Just out of
Mr.
curiosity,
Chairman.
did someone move out to create that open space?
Yeah, the city, there was, the city considered it an underutilized renter that was in there. So they weren't really using the space very much at all. And, they again want to nurture this partnership that we have, especially around the rental registry program, so.
Jessica, you might want to elaborate that this rental registry program that we're receiving the funding for is for only one specific area, and it's the 14701 zip code.
Correct, yes. Yeah, it is that 14701 zip code. Much of that is the city of Jamestown, but it does expand into that greater 14701 zip code.
Will there need to be any type of build-out, any type of renovations?
There's a little bit needed,
That's
just
not-
some extra, network lines and different things. But the space in general is just open space, so we just, have
Furnishings?
Yep, we have furnishings, and all that is covered in the grant for lead rental registry as well.
Okay.
This is sort of that first year of that grant, the anticipation of that money is to provide funding to build out those spaces that we're gonna need to support the program moving forward.
But it'll just be, there's no clients coming in or anything, right? It would be,
I mean, there may be,
Work
so,
out.
there could be, landlords coming in and talking to our staff about specifics related to their property and the property, work plans that our staff are gonna help develop. So there may be some of that. A lot of it is just gonna be a workspace for our field staff and our clerical staff to, be centered and be available to have those sort of, everyday working relationships again with the city officials that we would be collaborating with.
but any of those costs are covered by that grant?
The,
Communications,
yeah,
any
Yeah,
walls that need to
the
be
state
built?
has certainly recognized from the beginning that this is quite an undertaking, for the counties to take on these lead rental registries. There's a lot of compliance and regulation around it that we have to meet, and so, they've heard the advocacy on behalf, of us and the counties that say, we're certainly happy to comply with, this level of regulation, but we certainly need resource support in order to do that. So they've been very good so far, in providing those resources and that funding.
Was it Monroe County that had the model program,
yeah, it's
Rochester in
Monroe
particular.
and the city of the city of Rochester that has the sort
The
of
best practice.
program that this whole lead rental registry was based off of.
Okay.
Yeah.
Yeah, and it was something incredible, like 80% reduction that they saw in, level cases. It was pretty dramatic.
Yeah, because that's the benefit of this lead rental registry program is this is us being preventive rather than just reactive. So we're not waiting for a kid to be, testing with high lead levels. This is us getting into rental properties before the kids are even there so that we can address those issues and help the occupants and landlords address those issues so that, again, we're not just reacting once damage has already been done.
And And we and Jamestown are modeling that after Monroe, or is that the state that is modeling it after
So,
Monroe County?
yeah, so the state has, identified, I forget exactly how many communities of concern, but there's a number of zip codes that have been identified, through programming related to where those high, lead levels exist and where there are high densities of these elevated blood lead levels in children. And so the state identified which zip codes were zip codes of concern, and essentially then just said, you know, you county with this zip code, you are required to implement this program. So.
They
one-
did base it on the Rochester model, and there were like basically two different work plan frameworks that we could choose from in order to staff it and ensure that we have the infrastructure in place to be able to carry it out properly.
So this is targeted to 14701, but what if there's concerns outside of that? Does this cover?
So the lead rental registry program itself is designed such that every structure that has 2 or more rental units has to be inspected every 3 years for lead hazards. But in addition to that program, we also have our existing programs that allow us to go in and inspect homes where children are living, or where, if it's just a rental property, we can do these different types of inspections. So at this point, the state has given us essentially 2 pools of money, one for the lead rental registry and then the other for reacting countywide to reacting and to doing preventative for things like, you know, pregnant moms, or, you know, a grandparent all of a sudden has a child living with them. We can still go into those homes and do those sort of preventative inspections.
And then in combination with some other funding, you know, this legislator was very supportive to provide, you know, some original ARPA funds for us to then do some additional wraparound service work in this area, so that we really approached this in a comprehensive way instead of kind of that piecemealy thing, you know, that we're typically kind of subjected to in public work. So Jessica and her team have done a really phenomenal job in being proactive and thoughtful in planning, so that it doesn't, you know, just end up as kind of a very targeted, specific thing. Because we know that the housing stock in general across the county is an older housing stock. So, you know, we're going in and preventing a lot of, you know, health issues for children down the road, and at the same time improving housing stock for the county in general.
Any other questions, comments? Okay, all in favor?
Aye.
Thank you so much.
Thank you.
Thank you.
Where are we? Number 4 is to amend Chautauqua County Department of Mental Hygiene and Social Services 2024 budget for increased safety net costs.
Musical chairs.
Good evening, Blake Ehrig, Director of Administrative Services.
Good evening, John Anderson, Deputy Commissioner, Social Services.
Diana Songer, Deputy Director of Finance.
The resolution before you is, as we discussed last month, is to amend the 2024 budget to increased safety net costs. It's requesting to increase the contractuals by $2 million, and the fund balance, and using fund balance of 1.2. Last month, we discussed that it would be a very similar resolution that we presented in September, which is September, it was 2.5 million increase to safety net. So it's a little under what we expected, but still high nonetheless.
Mr. Chairman, I have a question.
Sure.
The third whereas, how does that relate to this resolution? And if you Want me to give you the answer? It does not.
Okay. Yeah, you're right. That must have been an oversight. Yeah, don't know why that was in there, but
It's immaterial to the resolution.
Yes.
It's just that I wanted to point that out, that
yes, thank you for.
that doesn't lead us to any conclusions
No,
for this
no,
resolution.
yeah. I have September's, resolution in front of me too, and I, looked like it was copy and pasted, just updating the numbers, so I don't know where that line even came from, but, cause that line was not in September, so. Yes, so that could be, a typo and crossed out if, you guys like to amend.
You might want to consider amending.
I'll make a motion that we amend
Strike.
and strike the third whereas clause, yeah.
Okay, do I have a second?
I second that.
Okay, all in favor to amend the motion by striking the third word out?
Aye.
Aye.
Okay,
Um,
stricken.
Sorry, Blake.
No, hey, that's a good catch.
Chairman, I have a question. So as we continue to like watch Safety Net grow and grow and grow, and totally, it's absolutely understandable. Can you talk a little bit about the preventative services that are in place to prevent the county actually from paying out so much in Safety Net? Are there things we can do?
We actually have a team that addresses homelessness. It's not effective at this point because we have so many people in temporary housing and homeless. As you know, it's been a big problem for the county and particularly Jamestown. But right now, we have the highest number of people who are in temporary housing that we've had in ever. It's a historic high of about 190. But when people come in, we have to address their situation, and if they are homeless, we have to provide services by statute. So on the preventive side, we have preventive restorative, we have case managers that work alongside people. Actually, we have a new program coming online within the next couple of months. It's called Supportive Family Support, Family-Driven Case Management Services with funding that's coming from New York State OTDA. It'll consist of 2 case managers, 2 care coordinators, and peers, because oftentimes people have some issues with mental health and drug and alcohol. So that'll be a combined unit that'll work with families to get them out of temporary housing. We also have some ability for families, help them get into rental housing if they're involved with the child welfare system. And then we also contract with other agencies such as COI. Every family that comes into contact with the department is referred there to help them get permanent housing and stable housing. There are rapid rehousing programs, rental assistance programs. We've lobbied the state. We're waiting for final approval for a program that enhances the supplement that is available for people for their shelter allowance. Right now, that is at final stage with DOB for approval. If that happens, what it would do is help people who come for help have enough resources available so they're near market value, near market rate for the ability to pay for rent. So it's been almost a 2-year process of getting to that point, but we're at that point now where it is with DOB. We had some questions from the state about a week ago. That's one thing that if that happens with the number of supplements that we've requested, there's a potential for significant savings of over $2 million. There's potential for that. So I think we have several things in place. We're working on, obviously, if we have hotels versus shelters, a shelter comes with supports and services, whereas our hotels do not. We're hoping very shortly the women's shelter will be open. Excuse me, I have a little bit of
Me too,
a throat
so I understand.
cold thing going on right now. So those are some of the things, and there are others as well.
I appreciate that, John.
Sure.
Is the number high because the weather got cold and they had no place to sleep outside?
Is it because of the
No.
cold weather? No, it's beyond that. Actually, today, we have capacity in our Code Blue Warming Center for 25, and it's been right around 20 people. So there are people who are coming for help. We have far fewer people in Code Blue shelter in hotels than we did last year at this time, but this is just people who are struggling with all kinds of complex issues right now. I think we mentioned before and talked about some of the pandemic relief that ended and the impact that that's had on families and landlords and rent costs. It's extremely high rent right now compared to even a few years ago, so people struggle with that.
Sounds like you're doing great work, thank you.
Evictions are higher?
That I'm not aware of. I'm not sure, maybe Jessica knows what's more going on with evictions, but we do have many more evictions, and when people are evicted, it's harder for them to get back into an apartment, yeah.
John, a question that some of my constituents or other people in the community have asked, are most of them residents, have they been residents for a long period of time in
Yes.
Chautauqua County?
Yes, by far.
You're still advocating, now the rate that we get aid from the New York State and also the federal government, you know, I'm sure there's, your departments across the statewide are advocating for a higher rate of aid. You know, if you look at what the state's portion is,
It's low.
slow, and the feds is real low, you know, but also we're not the only county that's seeing this increase, so the state, you know, I'm sure that they, you know, we look at it as we're spending unassigned fund balance of
Right.
1.2 million. What's the state spending in it statewide, right, for all the county? I'm sure all the counties are over budget in this.
Yeah, I looked at the statewide trends
Yeah.
in terms of temporary assistance, which includes safety net, and they are all up right now, very
Yeah.
high.
So you know, the
It's
state's
a statewide,
unassigned fund balance they're contributing just as much as us
Right.
in the long run. And I mean, that's why what their pushback probably is, cause theirs could be worse, but, you know, I think the state, in general, could add some more directive or some more things to help us mitigate some of the costs and in turn help them mitigate some costs. One's, you know, I think they could help with the housing situation, you know,
Mhm.
we're housing people in hotels. I'm sure we're not the only county that's facing that issue, you know, so they need to, as a state level, promote not-for-profits to get into this somehow and make it appealing for them to do so. And since they'd be saving themselves some money, I mean, do you know of any push that's actively happening in that?
There are some
regards,
funds available for rehabbing hotels into apartments. And
Yeah.
I know Mr. Hernandez, Carmelo, if you were here, he'd talk to you more about this. But he's definitely been working with some hotels and some private agencies on getting that in place. So he was mentioning that to me this morning. So he has had active conversations with hotel owners and with private agencies that can partner together and use state funds for that purpose.
Is it
So it's conversion projects, basically.
Is there enough funds? I mean, is it appealing for, would someone really
Yes.
consider it as a private owner, say, yeah, you know, it could be lucrative, or, you know, at the end of the day, sometimes it's not feasible, right? If they look at the numbers and say, well, they're just not it's not feasible enough.
As far as what he's told me about his conversations, that it is feasible. It
Okay.
could be feasible, yeah.
So hopefully that could be something down the road. That isn't gonna happen overnight, but maybe in 3 years, we might see some of that, hopefully.
Yes, that's the intent.
Do you see another request like this in the future?
Not this year.
Excellent answer.
Not the next 20 days,
Guarantee
huh?
that, right?
Yes, I can guarantee that, yes.
What about next year?
It's hard to tell, honestly. We're hoping that this is the peak. I mean,
Yeah.
but, and we did increase the budget, compared to 2024 to 2025, so we hope we do see a dip, into next year, but time will tell.
I know. I just had to ask it. Anything, any other questions, comments? All in favor?
Aye.
Aye.
Thank you.
Thanks, John.
Yeah, with you guys.
Okay. Last is our discussion, which is going to conclude our CPS update. Carmelo, and Director of Community Mental Hygiene Commissioner of Social Services, and Lori Dolce, Director of Certification, responsible for Child Protection Services. Lori's here.
Good evening, Lori Dulce, Director of Certification. I'm very happy to say I'm here with nothing but good news. All of our provisional hires have passed the exam, so we are in a very good place. We currently have 2 CPS vacancies and are conducting interviews next week. Neither of these was unexpected. It was more a matter of waiting until we had final test results before we filled those positions. But we will be conducting interviews and getting more people in the door. Caseloads are still at a more than manageable level. Yet intake is still where it has been, so our workers are just doing an excellent job, to be very honest. Comparing this year's intake to last year's, we are on par to be about the same. We do have more staff now that are fully trained and carrying caseloads, so that's helped. But right now, as almost a bonus to that, we have 4 staff who are not yet carrying full caseloads because they're in training. So the numbers are only going to get better at this rate.
When will their training conclude?
I believe the last person finishes in mid-February. We have a few that'll finish next month. And in the meantime, they're providing support to the other workers.
So, yeah, I wanted to bring you back one more time just to year-end wrap it up.
Yep.
We've talked about this, obviously, for, 3-4 months now?
No, I'm always happy when I can come and give a positive update, so.
Well, and it has been positive, I believe, through these past months.
Any communication is positive.
Yes, and I believe we're in a much, much better position right now than we were at the beginning of last year.
Absolutely. I think it was a matter of getting everyone to kind of a steady baseline where everyone was kind of on even footing. We had, we do have a big disparity between experience levels in our 2 offices. And it ebbs and flows over the years. There's times Jamestown has all the experienced staff and times Dunkirk has all the experienced staff. Right now it's Dunkirk that has the experienced staff. But our Jamestown workers have been there. They've been progressively taking harder cases, expanding their training. The new staff we've brought on have been doing a great job. So we've got a very bright future.
Well, I, for one, very much appreciate all the hard work.
You're
and
welcome.
I appreciate you coming and sharing it and communicating with us.
Absolutely.
So all employees are happy? That's where this all started, with this one employee.
It did. And you know what?
Everybody's happy.
I will say that I am sure that there are people who are still not happy for various reasons. And the day I figure out how to make every single one of them happy, I will share that trick. But I will say that we do have ongoing discussions. And as issues are coming up, we're trying to tackle things one at a time so that it doesn't compound. I think it was really a situation where things were building and it was getting to a point that it felt unmanageable, even if it wasn't unmanageable, just because there was no end in sight. We got through the worst of that, and now they're really in a very good place where now we can tackle issues one-on-one as they come up.
So there's a better process in place to,
I hope so. I feel that there is.
yeah.
I try to be fairly accessible to our frontline staff, definitely to our supervisors, and if things are coming up that are systemic issues that we can work to fix, we do that in the moment, so that things don't, boil over to the point that workers feel it's unmanageable.
Well, we thank you very much.
You're welcome.
Job well done.
Thank you.
Just a comment, as a legislator sitting here, it's important to hear each story and work through this as we have, listening to the employees, listening to the various leaders of the department and managers and such as yourself. It's important that we've heard it, we've listened to it, we've asked things, we've made suggestions, but we really have just been ears, and that's great to see the situation kind of getting resolved by all the hard work of everybody involved, and like you said, not everybody's always going to be happy, but there's got to be some concession on each side at the end of the day to say, yeah, okay, we still have a job to do. And at the end of the day, that's where, that's what we want the work to get done. And however the best and most efficient way and safest way that can happen, that's what we wanna see done. And,
Absolutely.
me as a legislator, I'm always approachable in this committee. I'm sure I don't wanna speak for the committee, but, we're thankful for you coming in and also giving us the updates and also us poking at you too to get some information, because it is need, it's necessary, because,
Absolutely.
we need to make sure we're doing what we need to. So, thank you for being patient with us as well.
Absolutely.
Okay, well, and through the year, I wouldn't mind coming back in 3 months, 6 months, something, just to say, hey,
Keep us updated.
Yeah,
things are good,
absolutely.
or we need to do this. So,
I'm more than happy to. Just let me know when you want me back.
and you've been very responsive, and I appreciate that, and coming in, so, anything else?
Nope.
Thank you.
Thank you.
Thank you.
Is there any other business to be discussed tonight? If that's the case, I would like to wish everybody a Merry Christmas and
Merry
ask for
Christmas.
a motion to adjourn.
I'll make a motion to adjourn.
Second.
Second.
Merry Christmas to
All
you
in
also.
favor?
Aye.
All in favor? Aye.